Well, good afternoon. My name is Bill Patterson, Principal of Flexible Benefit Systems here in Dallas. And I'd like to introduce Devin Herrick, Senior Fellow for the National Center for Policy Analysis with offices here in Dallas and in Washington, one of the top subject matter experts on healthcare reform. Devin, I believe you've even testified in front of Congress on several occasions, been quoted, and it's been a pleasure interacting with you over the last year. In fact, a year ago, we had a seminar about this time of year on the first 100 days of the Obama administration, where we explored the possibility of this bill and some of Obama's vision, and have had an interesting experience going back and forth over the year, watching the different bills, watching the debate in Congress, if you really want to call it that. And so it's been an experience, a unique experience. We want to thank Health First TPA, Tom Slack, the CEO, and Mark Hobgood. And we want to thank them for their sponsorship of today's event. And at this point, let's go ahead and get right into it.
The landmark health reform legislation will change the way millions of Americans get their health coverage. It will also have a huge impact on the type of coverage that employers are allowed to offer for their employees. There have been 8 different pieces of healthcare legislation during the past year, 9 if you include President Obama's proposal released just before the White House summit. For example, there were 3 separate House committee bills and the final House bill. There were also 2 Senate committee bills and the final Senate bill. There was no conference committee used to combine the 2 bills, so in a very complicated legislative maneuver, the House passed the Senate bill unchanged with the promise there would be fixes to come later. These 2 pieces of legislation will fundamentally change our healthcare system. For example, the Patient Protection and Affordable Care Act was passed by the Senate on Christmas Eve, but in return for their passage, House members demanded a laundry list of changes to combine with the new reconciliation bill because it would not need the 60-seat majority to pass. The Senate bill and the House reconciliation bill have both passed the House and the Senate and have been signed into law by the presidents. Employers now face a lengthy set of new, comprehensive health care laws. Here's what we know, and here's what you can expect. The Congress's approach to expanding health coverage included a new law that will require all individuals to have health insurance. Many employers will have to subsidize much of that cost for their workers. It would also create a new state-based health insurance exchange where individuals and small businesses could purchase coverage. Benefit packages will be standardized with 4 different tiers of benefits. In addition, new health insurance regulations were also enacted. Medicaid eligibility will be raised and new subsidies will be enacted to help moderate income workers better afford coverage. Small firms will also receive tax credits.
Well, you know, many larger employers or any employer that has an established plan where they're making a modest to robust contribution will probably see maybe no change at all. Some of the employers that might not have been as generous with some of their contributions will see a minimal effect. Some employers that haven't provided any benefits at all will probably receive the brunt of the cost in this, possibly costing them some competitiveness in their marketplace, definitely some profitability. Also, many states are going to be challenging many of these provisions as we sit here now. I think there's as many as 8 or 9 states with more coming on board, some of them linking together. I think Virginia is out on their own, so that should be an interesting set of exchange over the next couple of months.
Well, just to recap what this legislation will do, it'll create an individual mandate that all legal residents and U.S. citizens must have health coverage. It will create an employer mandate or an employer pay or play that they must either pay a penalty or offer coverage to their workers. It will also create a new insurance exchange, which is a one-stop shop where you can get coverage. It'll also expand regulations and create standardized benefit packages, expand Medicaid, and create subsidies for low-income Americans. One thing it will not do is create a public plan option. This was probably the most rancorous item of the debate for the past year.
That really the House wanted that so bad.
That's true.
The Senate being a little more realistic in their objectives, but nonetheless, I'm happy to see that one gone.
Well, what can you expect for the next year? Well, in 2010, there will be new regulations taking effect. For example, there will be new limits on pre-existing condition exclusions. Dependents will be able to enroll on their parents' plan until age 26. There will be no cost sharing on preventive care and certain screenings. There will be a ban on lifetime benefit caps. Rate review and premium increase disclosures also required. Group plans must provide an appeals process, and there will be a new reinsurance plan for early retirees.
So I'm assuming that the HHS will promulgate these regs, and they should be forthcoming hopefully soon if these are going to be enacted immediately or define what immediate is. Some of these will provide some administrative simplification. I'm all for the preventive provisions, and it looks like a plan will have to pay 100% for a lot of these procedure codes that are deemed to be preventative. And that rate review and premium increase right now seems to be in the fully insured marketplace, but might somehow cross over into the self-insured also.
In 2011, we'll have penalties for non-qualified medical use of HSAs. The penalty will double from 10% to 20%, plus your marginal income tax rate. There will be a standard for qualified medical expenses for HSAs, health savings accounts, health reimbursing arrangements, and flexible spending accounts. Basically, what this will do is it will prevent you from using this tax-preferred account to get your over-the-counter drugs tax-free. There will also require a rebate for medical loss ratio of less than 85% for large groups or 80% for small groups.
It seems like plans that paid almost all the cost of everything, it seems where their direction seems to be. I've always been a fan of how HSAs and FSAs help an employee become a better consumer of medicine.
Well, it seems the new regulations are really going the opposite direction. They truly believe that cost sharing is an impediment to access to care. So if there's anything that it seems like a trend, because of the required benefit packages, that they will do away with some of the cost sharing simply because that's how what they feel is the way to have increased access to care. But I too like the benefit of allowing consumers to control more of their own health care dollars. Also in 2011, you'll have new employer regulations. For example, grants for wellness programs for small employers. This is roughly, I think, 5-year grants, or up to 5 years. Employers will have to declare the value of health benefits on your W-2. It will also create a simplified cafeteria plans for small employers.
I'm in complete agreement again on the wellness issues. Many of these small employers will really want to research some of these grant opportunities. Wellness for a small employer isn't generally going to provide a lower cost of the benefit plan. However, I think through the wellness trends for employees, better engagement at the workplace, and just a healthier workforce, the value of these health benefits disclosed on the W-2 sounds like a headache in payroll to me.
That does to me too. Well, this is when we'll really feel the full impact of the recent health care legislation that was passed into law in 2014. This is when the individual mandate will take effect that most U.S. residents and citizens and legal residents must have health insurance. There will be a penalty for large employers that fail to offer coverage. There will be new subsidies for coverage for small employers. Large employers with 200 or more workers will be required to automatically enroll their workers into the health plan. This is when they will create health insurance exchanges, and also the Medicaid eligibility will be expanded to 133% of the federal poverty level.
I guess in 214 is where it hits the fan. And I'm a little concerned with most employers already automatically make their employees eligible, so that's some interesting language, and that increase of the federal poverty level is certainly going to put some additional state burden on their Medicaid costs. I think initially the thought is there will be federal dollars for that phased out over time, so ultimately that expense will remain at some point in time in the future on the states.
Well, the Congressional Budget Office estimates that about 28 to 29 million Americans are expected to enroll in the state-based insurance exchanges. They believe that about 8 to 9 million people currently enrolled in employer plans will probably drop coverage, but they also believe there will be some people that currently are not taking the company health plan will enroll.
Well, this is an area I believe that some employees and self-employed are going to play the market, if you will. These penalties are very modest, and a person might be inclined to just pay the penalty when it comes time that they need health care, jump onto one of the plans, take care of their medical expenses, and jump off. So I'm real, the logic of that just sometimes escapes me. I believe the IRS is going to be the policing mechanism, as we've heard, to possibly create 16,000 new IRS jobs. Certainly have some new jobs in this bill. But the fear of most insurance companies are that penalty play is going to really cost, as I can see it, a nightmare for trying to figure out what the cost of these plans are going to be.
Well, yeah, in 2014, the penalty will only be $95, or 1% of your income. But by 2016, that has been increased to $695, or 2.5% of your income. So I can easily see how a lot of people would just, like you said, they would play the odds. Knowing that they can go without coverage, they can free ride, because they can always enroll when they become sick. I think the insurance industry is especially concerned about this as well.
And I guess logic would have to dictate that over time, multiple fixes and changes, if this even stays its course.
Also in 2014, this is when the health insurance exchanges would be created. A little bit more about these. These are state-based markets where individuals and small employers can obtain coverage. It will feature standardized benefit packages with 4 different tiers. Required guaranteed issue, premiums not adjusted for health status. This is guaranteed issue community rating. They will allow age bands of up to 3 to 1. What that really means is that young 22-year-old marathon runners could only be charged, say, 1/3 as much as people that are nearing retirement with high health cost. They would also allow like a 1.5 to 1 adjustment for things such as tobacco use and family composition. It would also create subsidies for moderate income people to use in the exchange.
Well, just the creation of this new state-based pool is going to be a very large burden on the state. I'm in favor, and always have been, of some of the issues on individual policies. Guarantee issue requirement has always been something I've felt would have been important. But some of the subsidies for the middle income, there'll be some middle class enjoyment of some of these benefits.
Also in 2014 is when the employer mandate begins, this is a requirement that most employers offer health coverage or pay a penalty. Now technically they're not required to offer coverage, but if their workers seek a credit in the individual exchange, the employers could be penalized. Employers with less than 50 workers are exempt. The penalty would be roughly $2,000 times the entire workforce, excluding the first 30 workers.
Some of these penalties are very. I've watched this, and we've been putting a pencil to it. We're really looking forward to some direction as some of this comes forward. But some of the employers might even choose the exchange as their benefit plan itself. But I think many employers are going to have to really chart, a lot of thought in what directions they take from here.
Now we'll look at how this will affect different sizes of employers. Employers in 2014 with more than 50 workers. This breaks into 2 different types. Those that offer no coverage. For example, if an employer with more than 50 workers does not have a health plan, Their penalty, if those workers seek a subsidy in the individual exchange, would be $2,000 times every worker in the workforce, not just those who got the subsidy, but they would exempt the first 30 workers. Now, for those employers that actually offer a health plan, but you have one or two of their workers get coverage in the exchange, their penalty would only be $3,000 per subsidized worker. Now, small employers, as I said before, under 50 workers would be exempt from this. And again, large employers with 200 or more workers would be required to automatically enroll those into their health plan. But something else is that the larger employers would be required to offer eligible workers what's known as a free choice voucher to get coverage in the exchange. There would also be limits on deductibles and the cost sharing that your workers would face, but this will be mitigated to some degree by whether or not the employer offers some type of assistance toward the deductibles, like an HSA or an HRA.
I'm still wrestling with this free voucher and how they're going to calculate the value and putting it in there. Yeah. So I'm really looking forward to how they felt this is going to be accomplished.
Now, looking at employers with less than 50 workers, beginning in 2014, there will be no penalties for failing to provide coverage to your workers. These employers will have access to the health insurance exchange. In fact, firms with up to 100 workers will have access to the insurance exchange as their health plan, and there will be tax credits for providing coverage to their workers.
So now, employers over 100 will not have that access to
that's
the
correct.
Exchange. So there's going to be the employer-provided marketplace, and those employers are going to have many options that will continue. But some of these subsidies under 50 employees are going to be some opportunities to help their employers get coverage for these employees.
Now, looking at the subsidies for small employers, they phase in really in two parts. For example, from 2010 through 2013, small employers can get a credit for up to 35% of the employer contributions to the employee's health plan, so long as the employer pays at least half of the premium. There'll be a partial credit, for those employers that only have 25 or fewer workers, as long as their average wage of their workers is less than $50,000. There'll be a 25% credit for eligible nonprofit organizations, and the credits phase out as firm size and average wage rise.
That's I'm looking forward to seeing how they're going to calculate that, so it really penalizes firms with higher wage bases. So that's
Small employer subsidies phase 2. This takes place in 2014 and later. There will again be a credit for eligible employers purchasing coverage in the health exchange. There'll be a credit worth up to 50% for employers to pay at least half of workers' premiums, but this will only be available for 2 years. This 50% credit only qualifies for, the full credit only qualifies for employers that have 10 or fewer workers whose average wages are $25,000 or less. A 35% credit for eligible nonprofit organizations. Again, the credit phases out as firm size and average wage increases. Just to give you an idea of the types of subsidies in the exchange, beginning in 2014, people going from roughly 100% to 133% of the federal poverty level, they would have to pay no more than a premium no greater than 2% of income. But when you reach, say, 200%, 200 to 250% of the federal poverty level, your premium could not exceed more than 6.3 to 8.05% of your income. And after your income reaches 400% of the federal poverty level, up to 400%, you would have to pay a premium no greater than 9.5% of your income. Above 400%, and you would not get a subsidy. And 400% roughly corresponds to around $88,000 per year for a family of 4. Within the exchanges, it would also create a standardized benefit design. For example, it would mandate essential health benefit package providing comprehensive services. There would be essentially 4 different plan tiers. They call them bronze, silver, gold, and then a comprehensive plan for people 30 years old or under. The cost sharing would be limited to no more than $5,950 for an individual, or $11,900 per family. Now these are the same limits as health savings accounts, maximum out-of-pocket deductions. It would prohibit lifetime caps in 2010, as we mentioned earlier, but it would prohibit annual caps beginning in 2014. Dependents, of course, could enroll until age 26. And the HHS Secretary, the Secretary of Health and Human Services, can define benefit limits annually.
Wow. So looking at those out-of-pocket maximums, those would be, again, tied back into, they looked at the health savings accounts and went backwards. So the
index for inflation.
And the HHS Secretary certainly has a lot of power in this whole game.
Also in the standardized benefit package, you have a minimum 60% actuarial value, which is defined as essential health benefit package. What this really means is they would preclude employers from offering plans that required cost sharing of more than 40% of your medical needs. The lowest tier is the bronze, for most workers that is. The bronze must cover 60% of all medical cost. Above that would be a more lavish plan called the silver. It would cover 70% of benefit cost, and of course the gold would cover 90% of benefit cost. There would be a comprehensive plan with HSA health savings account limits up to people age 30 and below.
And so basically all these different percentage levels or these different plans levels will all tie back into the out-of-pocket limits or the cost-sharing limits we described earlier. So realistically, all the different levels of plans will just cause you to get to that out-of-pocket maximum quicker the year, but basically the same out-of-pocket maximum. Nobody in the industry seemed to have been at that discovery meeting.
Well, yeah, I think you're right. For high medical users, you're essentially saying what would happen would be for those people with high health costs, they would get to their maximum sooner with certain plans than others. Also, as part of the standardized benefit design, the out-of-pocket limits would be subject to income, and they would be based on health savings accounts limits, which is $5,950 per individual or $11,900 maximum per family. Well, for example, for a family earning between 100 to 200% of the federal poverty level, their out-of-pocket maximum limits would be 1/3 of HSA limits. For those earning between 200 to 300% of federal poverty level, it would be roughly 1/2 of the HSA limits. For those earning from 300 to 400 of the federal poverty level, it would be about 2/3 of the HSA limits.
It seems here that the only cost savings opportunities here at all is really through provider cuts, and because obviously the plans are set up for maximum usage and maximum payment, so there's going to have to be a lot of thought on how does an employer manage these costs.
Yeah, I agree that these plans are really designed to reduce cost sharing for workers, and they take away the incentive to be wise consumers of their health care and to ask prices.
Many initiatives employers have tried to foster within their communication with their employees. So to me, it's kind of a setback in some aspects.
Some of the other changes, and I've already mentioned a few of these, the contribution limits to a flexible spending account would be no greater than $2,500 annually. Currently, there is no limit, I do not believe. Over-the-counter drugs will become taxable unless your doctor gave you a prescription. There would be an excise tax on so-called Cadillac plans, those that cost in excess of $10,200 per individual or $27,500 per family. They would have a new program where wellness plans would allow employers to vary premiums by as much as 30% in an effort to induce people to be part of the wellness plans, a sort of a carrot and a stick. And again, as I mentioned earlier, there would be temporary reinsurance for early retirees between the age of 55 to 64. This would pay 80% of claims for medical costs between $15,000 and $90,000.
I'm just so upset to see the FSA is always, in my opinion, been a tool of just medical risk management on behalf of the employee and their own financial planning.
Here's some other resources you can go to find out more information. My employer, the National Center for Policy Analysis. Also, there's RAND Corporation has a website where you can compare the different health reform aspects. Also, the Kaiser Family Foundation has a wealth of information on their website that you can find on state data, on Medicare and Medicaid, and so forth.
Well, I've always enjoyed hearing and visiting with Dr. Goodman, and over the years listening to his advice and counsel in the area. A lot of this whole current law completely goes against some of the philosophies that you've enjoyed and fostered.
Absolutely.
And you have quite a few tools on your website to do. This has been, again, intended to be an overview within 72 hours of the law going into effect. And we hope we did that for you. Know that in mid-April we're going to have my seminars called Labor and Benefits Roundtable, and we're going to have a live event here in Dallas with a couple of the HR associations here in Texas, and that'll be a live event that'll be webcast also. We will also be having other panel discussions like this to drill down and offer a more in-depth. I guess give us 2 weeks to read it a little bit further, and we'll be much more detail-oriented. So, on behalf of Tom Slack's effort and Health First, and I've enjoyed this week. We look forward to seeing you here in the next couple of weeks. Have a great day. Thank you.